If I asked you, who is your favorite power couple? Would you say Beyonce and Jay-Z? Maybe Ryan Reynolds and Blake Lively? I don't know, maybe Bert and Ernie? Well, if you're a benefits nerd like we are, maybe you'd say HSAs and high-deductible health plans. Well, have we got some juicy news? There could be a riff at works here, folks. Straight out of DC, there is a proposed bill that suggests decoupling, that's right, decoupling HSAs from HDHPs. Boom. Now to dish on this dirt, we brought on Executive Vice President, Service and Delivery and Operations here at WEX, Chris Bird, and he's going to tell us all what is the legitimacy of this bill. Is this just a rumor mill? Is this thing going to pass? Is it not going to pass? Moreover, what could this mean if something like this passed? What does it mean for consumers? What does it mean for employers looking to provide health plan options to their employees? Woo, it's going to be fun. My name is Eric Peel. I'm the host of the Benefits Buzz podcast, and I'm joined as always by my co-host, Kelsey Burgad. Ready, set, let's get buzzed. Well, hey, welcome everyone to another episode of Benefits Buzz. Kelsey, how you doing this morning? We're recording at 8 a.m. here in Fargo. Rise and shine.
Rise and shine. Coffee in hand, we're ready to go.
I love it. Well, as you and I love to do, we were paging through the hundreds and hundreds of pages of legislation the last couple of months. And boy, one that just that caught our eye that we had to earmark was the topic of this HSA decoupling. And we were like, whoa, what's going on here? So we definitely need to do a podcast episode about this. And so I'm super excited. I know you are, Kelsey. We've got Chris Bird, Executive Vice President of Service and Delivery and Operations here at WEX on our show. Chris, welcome.
Thank you so much. It's 9 o'clock. I'm on the East Coast, so you guys have been generous to me. My 3 cups
gave
of
you
coffee.
that hour.
Woke up, got my workout, got my 3 cups of coffee. I'm ready to go.
We're jealous, Chris. Well, we joke about reading these hundreds of pages. I know you most likely do, and it's part of your job to be up to speed on all of the legislation that has basically floodgated us in the last couple of months. And so we're super excited to talk to you about this particular topic and kind of glean from your expertise, because I think there's a lot of HR professionals listening that are definitely have their interest piqued with this topic. So I think we just jump right in, if you don't mind. Of course, I think it'd be smart of us to probably, before we just, dive right into the whole decoupling proposal that's out there, would you mind just maybe start by giving us this kind of a brief overview of, I guess, maybe the current requirements that are governing the type of health insurance that would kind of enable or establish someone in a fund and health savings account for us?
Yeah, sure. And I won't get into a lot of, minutiae and details, but I do think the context is really important here, because you can't understand the decoupling proposal unless you understand sort of the original founding principles and sort of structural limitations on health savings accounts, and also what's happened in the intervening months and years to understand why this is being proposed. So health savings accounts, as most of the audience knows, were established in 2003. And they had some very, very narrow structural guidelines, if you were, that were built around them. And the most important one was that in order to establish and fund a health savings account, you can only have an HSA qualified health insurance plan. You can't have any other health insurance that covers medical conditions, right? And what is an HSA qualified plan? That was extremely narrowly defined. It said that health plan has to have a minimum deductible, so the deductible can't be below, for this year, $1,400 for an individual and $2,800 for a family plan. There were also maximum out-of-pocket expenses that were associated with the plan, and nothing else can be covered underneath that deductible until you've satisfied that minimum deductible, other than preventive care. So really, really tight guidelines around what that qualified health plan can cover. And that has tended to kind of put some shackles on insurers and employers, and it has tended to somewhat limit access to health savings accounts to a lot of people.
That's interesting, Chris. Ever since I started working at WEX, I've known those rules to be true. What qualifies you to be in an HSA, but can you give us a little insight into why they put those requirements in place?
Yeah, the founding principle around health savings accounts is really to reduce the disconnect between who is paying for the health care and who's consuming the health care. If you think about traditional health insurance, low co-pays, not a lot of consumer out of pocket, or what we always call consumer skin in the game, right? And the theory here is that one of the reasons why health expenses and healthcare costs in the U.S. have gone up so much faster than the rate of inflation is because of that disconnect, because the person who's actually consuming the care isn't historically, by and large, responsible for paying for that. There's not that much financial exposure. So why not go to the doctor if I've just got a little tickle in the back of my throat, for example? So the whole idea here was to expose patients to the cost of care. Most people were blissfully unaware of the fact that it costs the insurer or the employer a certain amount of money when they access the healthcare system. And the idea there was if you give the consumer that exposure and give him or her that skin in the game, you'd make them a wise and careful consumer of healthcare, right? This kind of built on the nascent consumer-directed health movement that began around the year 2000 and included what are known today as health reimbursement arrangements. And it was just sort of CDH 2.0, if you will. And it largely worked. I mean, the cost trend for HSA qualified plans has been lower than for traditional plans. And that's been proven by longitudinal studies for years and years and years. And health savings account consumers are more engaged. They're more likely to ask their doctor for other options, treatments, drugs. They're more likely to choose a generic drug, use a cost tracker to help manage their expenses, check the quality rating of the provider. So that was really it. It was all about consumerism.
That's really interesting, Chris. And perhaps the biggest reason that we're here today is to talk about this decoupling, right? So now there's a proposal out there to allow participants to enroll in the HSA, even if they're not enrolled in the high-deductible health plan. Can you share a little bit about what this proposal looks like and why we're proposing it now?
Yeah, sure. So Senator Ted Cruz introduced back in March a bill known as the Pandemic Healthcare Access Act. It's also being called the Cruz Bill by a lot of people who are running around Capitol Hill. It is an extremely simple proposal, and you're right, Eric. I've had to read a lot of legislation in my night job here as their government relations person, and it can be hard. I love to tell people this is the shortest bill I've ever read. It is extremely simple and focused. It is only 1 1/2 pages long. And when you read a bill, by the way, they're double spaced. So it is a really, really short bill. And as you noted, it decouples health savings accounts from the shackles, if you will, of the narrowly defined qualified health insurance plan requirement, right? And so what does this bill say? It simply states the following. Anyone who has health insurance can establish and fund a health savings account. It doesn't matter what that health insurance looks like. It can be a traditional PPO with co-pays and no deductible. It can be a very high deductible plan. It can be anything in between. It can be that hybrid where there's a deductible, but there are certain, for example, chronic care services that are covered underneath the deductible, maybe some prescription drugs. So a lot of flexibility there. It is a temporary provision. That's important to understand. It is the Pandemic Healthcare Access Act. And so what this bill says is that retroactive to March 13th, which is when the president signed the national emergency, declared the national emergency, to the end of the presidential declared national emergency. So think about it as during the period of the pandemic, that decoupling would apply. And the argument here is that, look, people right now, we still have unemployment above 10%. Everybody believes that this recession is going to be fairly long and fairly deep. It's going to be a slow recovery. A lot of people have been economically displaced, and people need help with their healthcare expenses now more than ever. And certainly with the pandemic out there, that's sort of doubled down the argument. So everybody should have the benefit of a health savings account, and people really shouldn't be denied that benefit just because they didn't happen to choose a health plan that has a deductible. And then, there's one other, this is less an argument than a reason why this is being advanced, and that's defense. there is, a lot of people are watching the presidential election, obviously. And should Mr. Biden be elected president, if you read the Biden public option proposal, it includes some pretty generous coverage, right? There would be one public option plan on every ACA exchange that would have no deductible. And the public option plans would have free primary care, right? Well, obviously those would not be HSA qualified plans. And so the Biden public option also allows employees to opt out of their employer-sponsored group health plan for any reason whatsoever. And so if you think about certain employees looking at a somewhat generous public option on an ACA exchange, maybe with some subsidies, they may just jump out of their group plan and jump into that public option. And so if you're a provider of health savings accounts, you want to be able to continue to have those individuals be eligible for a health savings account. And so there's that sort of, hedging against what may come in the future coming out of the election.
What challenges have arisen that are really kind of starting to constrain, maybe to use that word, the availability of HSAs?
A lot has changed. The world's changed, right? For example, we had the Affordable Care Act that came around in 2009, 2010, and was implemented largely in 2013. It didn't exist back in 2003 when HSAs were first established. We like to joke in the HSA industry that since 2003, there have been 20 versions of the iPhone released, and yet the requirements around what's an HSA qualified plan have been largely unchanged. So it's been a long time. The biggest change I would say is actually one it's broadly contextual and structural. In 2003, there weren't a lot of health insurance plans with deductibles. Today, 80%, actually slightly more than 80% of all employees are enrolled in a plan with a deductible. And the average deductible for an individual plan for those that are enrolled in a deductible plan is $1,550. So that's actually higher than the minimum deductible threshold for an HSA qualified plan. And yet many of these plans aren't HSA qualified. And so the people who are enrolled in them aren't HSA eligible because of tweaks in the plan design in terms of potentially, things that they might cover underneath the deductible. And so those plans aren't eligible and those individuals can't benefit from a health savings account. The other thing that's happened is over the years, both consumers and more importantly, employers, their desire is to have the flexibility to be able to cover certain things underneath the deductible, right? So, the idea here is, for example, if you were to cover chronic care, by giving that coverage underneath the deductible, you're really incenting the person to get the care, and you're not disincenting them to avoid the care. And certainly, if you're diabetic, for example, to get your chronic care, to get your chronic medications, is going to avoid much higher healthcare costs down the road if there are complications. And so, hypertension, diabetes, as I mentioned, prescription drugs, that's a big one, right? A lot of people are on maintenance prescription drugs and you can't pay those underneath the deductible in an HSA qualified plan. And then the last thing is access. Okay. There are a lot of things, and this is nobody's fault, by the way. We just don't think about these things when we pass legislation the first time. So we know we're going to go back and we're going to have to tweak it. But if you are a Native American and you go to your Indian Health Service and you receive treatment, you can't make a contribution to your health savings account for 3 months. These are little technical things. People who are still working past age 65 and who have to enroll in Medicare, and I won't get into the reasons why, but they really do have to enroll in Medicare, they can no longer contribute to their health savings account, even though they might remain on their employer's plan. And so access is another issue.
What arguments are there against this decoupling?
Yeah, that's a good question. And the strategy here is to get this temporary bill into the next COVID package. And if that can be done, then down the road, either in the year-end scrum, which always happens where you have some must-pass legislation, you make that permanent, or if Mr. Trump is reelected, then you'd work on it in the next session of Congress to make that made permanent. Um, the biggest argument against, the biggest argument for this, okay, is that it would solve the issues that we talked about earlier, because it would give employers and insurers full flexibility to plan this thing. And that's really important. And then it would allow more people to have access. But there are arguments against it as well. And the biggest argument is that this is a radical change. And it really goes against the founding principles of the health savings account movement, which was expose people to the cost of care and make them wise consumers of healthcare by giving them skin in the game. Because decoupling would allow anybody to have a health savings account, even if they had very, very generous health coverage. And don't forget, the Cadillac tax was repealed last year. And so there's no employer disincentive to offer generous coverage. It would turn the health savings account, another argument is it would turn it from a healthcare account really into a financial account. Think about it more as a hybrid between checking account and IRA, because you can invest the funds and you can save them for retirement. There still would be healthcare restrictions on what you could spend the money on, but it begins to become a little bit different in terms of the way people think about it. Potentially some political risk. There's been criticism from the left for years that health savings accounts are just a tax shelter for the healthy and the wealthy. I will tell you that criticism is largely now confined to the very progressive wing of the Democratic Party. Most moderate Democrats embrace health savings accounts because so many of their constituents have them, need them, and are really satisfied with them. But the political risk here would be, hey, now you're making it really, really easy for people to get an HSA. People who have a lot of money are going to pile into that as an investment vehicle, and it's just going to be a tax shelter. And the final one is a permanent change here would be very expensive, because the assumption would be that a lot more people would establish HSAs, fund HSAs, and the lost tax revenue to the federal government over a 10-year period could be very significant. And even though in the COVID world, when we have the CARES Act and all the following legislation, how much this cost doesn't seem to be much of a concern. At some point, Congress is going to have to look at costs again, because the federal debt has gone up so much by virtue of all of the spending that we've had to engage in to manage the COVID crisis. And so, that budget score could come into play in deliberations around a permanent change.
Yeah, this is, I think it's, if I put myself in the shoes of the employer, it seems kind of heavy, but there's certainly some implications on, the type of plans that they're providing for their employees and sort of the ramifications for this decoupling, right? What it means and what do they offer and how do they, again, right? Their goal is to make sure that they're providing their employees, with an opportunity to get the best healthcare that works for them. And so it's really interesting to see these different dynamics and these shifts and these changes, and who knows what the election brings. And I certainly know that, I think if we're talking about decoupling, that this probably affects more than just HSAs. It could maybe affect all of consumer-directed healthcare accounts in addition, right? So I wonder, maybe to kind of wrap things up, Chris, maybe talk about how, beyond just HSAs, but even FSAs, for example, how they might be affected. And then, of course, we can't let you leave without asking you to look in your crystal ball and wager whether or not you think this decoupling actually becomes a reality in the near term, which is what I think everyone's sort of waiting on bated breath for.
Well, first to the first question, if there were a permanent decoupling, I think that it's logical to predict that there'd be a pretty rapid and pretty significant reduction in the number of flexible spending accounts out there, and there wouldn't be many left at the end of the day, right? Because the health savings account it's simpler, it has very, very superior tax treatment. There is no use it or lose it associated with a health savings account, the biggest constraint on health savings accounts has simply been that not everybody can have one, right? And so if everyone can have one, if you're an employer, you just offer an HSA to everybody. It's very easy to explain. And why would you need an FSA? Other than a limited FSA, for people who really want to use the FSA for current expenses and use the HSA as an investment vehicle.
Wow. I mean, so many different things to think about. I've never sat down and really analyzed why HSAs had the restrictions that they did. And I've never thought about how the decoupling would impact FSAs and other consumer-driven healthcare plans. So, I mean, such interesting stuff. And I really appreciate that you took the time to read all of this so I didn't have to read the legislation and the proposal. So I really appreciate it, Chris. Thanks so much for joining us today.
You're welcome. This is a very fundamental change. It may or may not happen, but I don't think it's been talked about a lot broadly beyond those who really engage in inside baseball in DC. So I'm happy to sort of help to educate people about what's out there.
WEX is in the business of simplifying benefits for everyone. Now, although we certainly hope our podcast sparks some aha moments, like that was pretty cool, but of course we cannot provide legal, investment, or financial advice. And, well, therefore, nothing shared in this podcast should be interpreted as such. We encourage you to seek out appropriate professional advice regarding your plans. Hey, congratulations! You made it through our disclaimer. Thanks for listening.